My name is Claudia Rüb. I work at Imperial College Healthcare NHS Trust. I'm a specialist dietitian looking after patients who've had surgery of their upper gastrointestinal tract. That means either their esophagus or their stomach. When people have stomach cancer and undergo treatment and they feel anxious and quite down about the difficulties in eating and digesting their food, that is only the case for the first few weeks and months after their surgery, because the body needs time to adjust and be able to digest with the new shape inside. Over time, most foods will be tolerated again. After surgery, some of the challenges people might face are losing weight, not being able to absorb some of the vitamins properly, like vitamin B12, or some of the minerals like folate or iron. Dumping syndrome is another challenge that people might have to overcome. Dumping syndrome means literally what the word is saying, that the body is not able to cope with the amount and the concentration of the undigested food, is literally trying to get rid of it by dumping it down the digestive tract, and people then will have to go to the toilet very soon after eating, and they may also feel slightly dizzy or sweaty, and they will have to rest for these symptoms to pass. There are a few ways of minimizing the risk of experiencing dumping syndrome. For example, by splitting fluids and food. So trying to not have something to drink about half an hour before the meal, and then waiting about half an hour after the meal before you have another drink. Also, trying to have smaller portions and eating really slowly is going to make it much easier for your body to actually digest and cope with the food that is arriving after chewing. Another thing to remember is to avoid high sugary foods. Choose meals that have a small amount of starchy food, as well as protein foods and some fat. Another way to minimize problems with digesting food or digesting meals is try and opt for high-calorie, high-protein foods. Trying to not buy any diet products, but the full-fat yogurt or the regular ice cream, all of those things can help to maximize the calories and the nutrition that you're having with your meals. It's very important actually to continue to have meals and meal times with friends and family, and to continue to have a good routine to sit down and enjoy the food. After that adaptation period, almost everybody goes back to having a normal life. When I say normal, I mean they discover kind of a new normal where they going out for dinner, going on holidays. Some of those activities might be a little bit different, but the body is able to adjust in an amazing way. Most people will find that they have a happy life again.